Good evening. Advocates say it's a crisis moment in public safety. Now, an emergency meeting has been called to address growing concern over the province slashing funding from Toronto Public Health. A former city councillor who also served as a chair of the TPH board during one of the deadliest outbreaks our city has seen said that these changes can leave us vulnerable to a health epidemic. The year was 2003. Tourists were warned not to travel to Toronto. The city was gripped by a SARS outbreak. There were dozens of deaths countrywide. Thousands were quarantined here in the city. And according to then chair of Toronto Public Health, a lesson was learned.
What the province learned was that if you really want to save money on healthcare expenses, you should up your game. So they offered, and this has been the tradition for the last 15 years or so, putting in 75% of the budget so that no municipality would be tempted to cut back on public health funding.
The former city councillor says Doug Ford's provincial budget is taking public health to a dangerous place. The government is looking to make dramatic changes that would impact the 35 public health units in Ontario and consolidate them into 10, while also reducing funding by $200 million.
It really is a crisis moment in the public health world. And if cities are forced then to make public health units very difficult choices around what they're going to cut, that is going to be, today, save a few dollars, but later on, you're going to see increases in disease, ill health, which will cost the health care system much more money down the road.
Toronto Public Health has their hands in many places with vaccinations, disease prevention initiatives, the opioid crisis, and restaurant inspections, just to name a few. The province tells CityNews as consolidation occurs, it will work with public health units across the province to ensure effectiveness. A spokesperson from the Office of the Minister of Health and Long-Term Care writes, quote, "Modernizing and streamlining the role of public health units across the province will better coordinate access to health promotion and disease prevention programs at the local level, ensuring that Ontario's families stay safe and healthy."
This is an area where you want to add resources. There are all kinds of studies out there that show that $1 invested in public health saves $2, $3, $4, up to $10 in curative health later on. That's the kind of system that you want.
This author and health policy expert at the University of Toronto is sounding the alarm over what this will mean for the future of public health, adding that there are still many unknowns on what the loss in funding will mean.
One of the things I always say about public health is that if it's successful, it's invisible, because nobody sees the epidemics that don't happen and the outbreaks that don't happen. If you've got an epidemic of an infectious disease, if you know about it quickly, you can do something to keep it from spreading. And I rather like the idea that I can walk around, go on the subway, and not worry that I'm going to get tuberculosis exposure.
Mm-hmm. And with less money, you think we could? Can we be more vulnerable to that?
Yeah, we are. I mean, there is quite a few case examples that we have had where exactly that happened, and some of what we're doing in public health is precisely because we learned from mistakes that we made in the past.
What is the future of public health here in Toronto? That's a question being asked by many people after the Ford government released their budget, making dramatic cuts to Toronto Public Health. Well, according to the former board chair of TPH, if these cuts do come into fruition and the city isn't able to convince the province to restore the funding, there is one person who can stop it.
If they go backwards, and if cities are forced then to make public health units very difficult choices around what they're going to cut, that is going to be, today, save a few dollars, but later on, you're going to see increases in disease, ill health across the population, which will cost the health care system or the sickness system much more money down the road.
The former city councillor and chair of Toronto Public Health says Doug Ford's provincial budget is taking public health to a dangerous place. The government is looking to make dramatic changes that would impact the 35 public health units in Ontario and consolidate them into 10, while also reducing funding by $200 million. A special meeting is set to get underway tomorrow, along with members and representatives from public health voicing their concerns. Joe Mihevc will also be there and says if these cuts prove to have severe impacts on Toronto public health, there is at least one person who could turn things around.
Previous governments in the province of Ontario have deemed that public health's medical officer of health has the authority, if the municipality wants to screw around with that budget, to impose a budget on the municipality. Wow. That's how strong the medical officers of health authority lies. So that's another choice that is going to be part of the mix.
Toronto Public Health tells City News that they have been able to review this budget, though they don't know the exact impact it will have on them and Torontonians here in the city, just because they're still waiting to get more details from the government.